Part 2 is Attributes by Alice Karpinski. The central nervous system, or CNS, is responsible for learning. Nerves all over the body pick up sensory stimuli and send messages via the spinal cord to the brain. The brain interprets what has been seen, heard, felt, smelled, and tasted, and integrates new sensory knowledge with previously stored information, then decides what to do with the information. The CNS is highly influenced by electrical and chemical factors, and our neurons stimulate when we process sensory. At birth, these neurons do not touch, but as a person experiences more exposure to specific stimulus, the branches of the neurons begin to grow towards the next neuron. This creates a learning connection and allows for faster responses the next time that same stimuli is received. The brain is set up as followed. The brainstem at the base of the brain is responsible for the automatic functions of breathing, heart rate, and digestion. The cerebellum, just above the brainstem, controls body movements, including posture and balance. The cerebral cortex controls all conscious activity. It's separated into two hemispheres. The left controls the right side of the body, and the right controls the left. 65% of people who have larger left hemispheres than right 65 of people have larger left hemispheres than right, but people who have reading disabilities tend to have a larger right hemisphere, or hemispheres of equal size. The brain must create new memories when tackling new activities, including different types of school assignments. This can affect how a student learns if they have memory or sensory issues. Implications of brain injury includes concussions and can be caused by car accidents, falls, and sports accidents. The brain can be damaged from the initial contact or even from the brain being bumped and hitting another part of the skull. Girls are more susceptible than boys to brain injuries due to their smaller body frames, but children should be evaluated immediately after the injury. Multiple or severe concussions can permanently affect learning and memory and can lead to developing learning disorders. How a child reacts to the injury depends on several factors, including the location and extent of the injury, the individual's neurological maturity at the time of the injury, and the nature and extent of efforts to retain the brain. In serious injuries where part of the brain must be removed, other parts of the brain will try to compensate for the lost functions. This is known as plasticity, but tends to decline with age. Traumatic brain injuries also have been associated with higher rates of depression and sleep problems and may cause anxiety disorders or even PTSD. These can also affect a student's ability to learn. A person can also be born with an atypical structured brain, and it can be inherited. This is common in children with dyslexia, autism, and ADHD. In dyslexia, anomalies have been found in the left hemisphere of the brain, which is the language hemisphere, and there tends to be clusters of extra neurons and odd cell connections, affecting the ability to read. Research has found, however, that dyslexia does respond positively to intervention, and children with the disability can show significant growth with specialized instruction. Autism is a neurological disorder that severely affects a child's development, especially with socialization. Many children have distinct problems interacting with others, communicating, and maintaining socially appropriate behaviors. People with autism also cannot pick up on social cues or facial expressions as easily, since they tend to focus on one thing at a time. For instance, they will only look at your eyes and not notice the rest of your face, impairing their ability to read an expression. Autism can be genetic and is more common in boys. Research on how brains of people with autism are structured has been inconsistent, but most studies do show abnormality in various areas of its structure. ADHD has a distinct link to environmental toxins, especially when exposed to even the smallest doses of lead. ADHD is caused by an inconsistent processing of sensory input. Sometimes messages sent through the central nervous system are not processed in an organized fashion, making their ability to focus on a task for a long period of time difficult. The average maturity delay of a person with ADHD is 3 years, and they tend to have more excitatory chemicals in their brains, causing hyperactivity and impulse behaviors. There is, however, research that suggests children with ADHD process information coming from digital media, such as computers, much better. Biochemical medications such as Ritalin and Adderall seem to help people with ADHD sustain attention for longer periods of time, and improvement has been seen in 75% of cases who use these medications. These children also tend to improve the quality of their work when medicated. Biochemical irregularities can be influenced by pharmaceuticals, substances we eat, and things we drink, especially sugar, caffeine, and even chocolate. Ritalin has also been used to calm the tics of people with Tourette syndrome. The route of taking medications to ease some of the symptoms of these disabilities, however, is not always positive and can lead for potential abuse of the medications in the future. To learn, students must be able to attend to stimuli and code information about that stimuli, integrate and store data in memory, and be able to retrieve the data as they are needed. Learning disabled students have deficits in many of these areas. Our brain is constantly bombarded by our different senses, but the chemicals in our bodies help weed out the unimportant ones that do not need our current focus. Students with learning disabilities do not have these abilities, and it affects their learning. There's also current research with a protein nicknamed the memory molecule that has proven to help memory in rats. It is now being tested on patients with Alzheimer's and epilepsy. People with learning disabilities tend to have normal long-term memory and only struggle with short-term memory. The focus needs to be on teaching students information in a way that helps them store lessons into LTM as opposed to it staying in their short-term memory and risk being forgotten. Research also shows that quiet classrooms benefit the most students, as well as having white noise such as instrumental music playing in the background. Metacognition refers to the knowledge and control individuals have over their own thinking and learning. It is the ability to think about what one is thinking about, and is an active process where the individual examines information and makes decisions regarding the best way to learn it. Because metacognition requires an ability to think abstractly, strategies requiring metacognition are best taught to children over the age of 7. Children with learning disabilities, however, do not seem to transfer the practice of verbal rehearsal from one activity to another, and they must be reminded what to do. To help with this, children should be taught to make predictions as early as the first grade and visualization and verbalization techniques by age 8. Note-taking, verbal self-mediation, mnemonics, and mapping and graphic organizers are all useful tools, and teaching students to use these techniques can help students gain insights to their own cognitive and metacognitive processes. The first sign of phonological processing problems is delayed speech. By the time a child is 1 year old, they should be saying syllables, and by age 2, they should be combining up to 2 words for simple sentences. By age 3, they should be using pronouns. A delay in speech is also usually followed by reading and language delays as well, due to the brain struggling to process different sounds and order of language. Phonologically based reading disabilities, or PRD, are characterized by difficulties in acquiring alphabetic or phonetic reading strategies. These students will struggle with memorizing sight words. Also, due to not having an encoded memory of a sound referring to a distinct letter, students with PRDs may struggle with spelling. Phonological processing takes place in the left half of the brain, and people with PRDs tend to have atypical left hemispheres. Students with PRDs can still learn to read through the right instruction, and using assistive technology is recommended. These students often benefit better from visual cues for instruction, directions, and assignments.